And over the last 2 years, we've seen a 96% increase in the number of referrals coming to our organization. 58% more just in the last year alone.
At the Second Wind Fund, they believe more kids looking for mental health care means a bigger impact.
So while that's a dramatic increase in terms of demand, what we see that meaning is that we're actually starting to see more acceptance and approval of therapy.
Second Wind started 30 years ago after 4 students in one Jefferson County high school died by suicide.
We're finally seeing results. And I think that means a lot, not only to the organizations, but much more importantly to the communities and parents that have kids.
That the suicide rate for youth ages 10 to 18 has fallen to its lowest level since 2007.
Lena Heilman leads the state's Office of Suicide Prevention, which measured not only the lowest rate among youth in nearly 2 decades, but also half the number since its peak, from 87 in 2020 to 39 last year.
Any one death by suicide is too many and is traumatic for lost survivors and for the community. And we see any decrease as optimistic and hopeful because it means that our programs and our efforts across the state are reaching more young people at critical times.
A long list of statewide programs with different but overlapping goals, from fostering better relationships to continuing care after a hospital visit, firearm safety, even free therapy sessions.
And we need to continue to do this work if we're going to continue to keep these trends in their current direction.
So this data focuses on kids specifically, but a few months ago we were able to report Colorado's total suicide rate across demographics was also seeing a promising trend. That group as a whole was starting to stabilize after it also reached a peak in its pandemic years of 2021.
Well, this is great news, but my first initial thought was, of course, the federal funding. Is this going to cut these programs that have drastically decreased the suicide rate?
So the answer is a little unclear, but the answer is not today, maybe in the near future. A lot of the programs are pending if a grant is going to get renewed, pending if it's going to look the same it has in years past. Certainly something these organizations are nervous about in the state too. So we will see, but definitely a risk. Which is scary, right?
It
is.
If
things are working, it's scary.
That's right, because even though things are working, you think that they want to dive into and see what is working so they can keep that going.
Right.
So the rates are going in the right direction.
Exactly.
Yeah.
Right.
All right, Jenny, thanks. Remember, if you are struggling, there's always help available. Colorado Crisis Services has counselors available 24/7 if you need someone to talk to. Their number is on your screen. You can also reach out to the National Suicide and Crisis Line by dialing 988.